Hi, welcome to Protecting Your Employees During the COVID-19 Pandemic. We'll get started in just a minute. We're going to let people come on in. And I apologize, my video doesn't seem to be working, but my name is Shonnessy Gilmore and I work with EHSI, and I'll do a little more of an introduction once we give people a second to get on. We still have some people trickling in, so I'm going to give it just a little more time and get started. All right, I'm going to go ahead. So my name is Shonnessy Gilmore. I'm a certified industrial hygienist and certified safety professional with EHS-International. We are a subsidiary of Sound Earth Strategies, so they've invited me in today to do this soundbite presentation. My background, in addition to my industrial hygiene and construction safety background, I was an infectious disease researcher and trained in public health microbiology. I have a master's in public health in environmental and occupational health from the University of Washington. That department's been doing some great things during the pandemic. So the focus of my research was antibiotic resistant bacteria, but I do have a background in virology and various public health. So I'm really excited to give this presentation and hopefully give everybody some practical skills to bring back to their workplace. Since we only have an hour for this talk, I'm not going to be able to talk super in depth or extremely specifically about any one industry, but you can always reach out to me. My contact information is at the end of this presentation. And, you know, if you're in a healthcare setting or a school or, you know, do mostly field work or things like that, please reach out and we can help you figure out what you need for the work you do. I'm also extremely excited to announce that the Department of Labor and Industries has given EHSI a grant to do 8 free webinars on different topics about COVID-19 protection in the workplace. So I'll have the opportunity starting in January to give in-depth talks where, you know, each hour will focus on just engineering or just ventilation, things like that. So I'm really excited about that. We will include everybody who's on the mailing list today, and we'll be advertising that a lot more soon. So today we're going to talk about some updates on COVID-19. As you all know, it's been a very exciting week. Some basic precautions for the workplace, things that you're required to have if you are doing in-person work right now. Different upgrades you can do for your ventilation systems. Some are free, some are very low cost, and they're all pretty understandable for the layperson. We're going to go over sanitation, hygiene, and personal protective equipment that's required right now. Talk a little bit about what I see in the field. I do COVID swab and air sampling for some of my clients, and just some of what I've seen over the last several months. And then we're going to talk a little bit about other concerns someone might have when they're reopening a building that hasn't been occupied for a while. So we've learned so much since the beginning of the pandemic. This virus is systemic, meaning it doesn't just attack one system of your body. It's not just your lungs. It's also kidneys, heart, your brain, your circulatory system. We've learned that there's a lot of comorbidities associated with it. Age has a very strong association with negative effects from the virus, but being overweight, having diabetes, having different pre-existing conditions, which about 70% of the US population falls under people who would have a higher risk from COVID-19 infection. So it's a huge proportion of our population. We've also learned that it's mainly spread through airborne and droplet means, and I'm going to explain what the difference between those are from a practical standpoint on the next slide. But airborne means that it's an aerosol. It's a very small particle that can linger in the air for up to 3 hours. Droplets are larger, you know, they contain more saliva, and they typically fall to the ground within 30 minutes. Just talking can produce droplets that linger in your airspace for 8 to 14 minutes. We also know a lot more about the distance of travel. The 6-foot guidance is based around droplets, which are those bigger particles, and typically the bigger particles are going to fall down within about 6 feet. But those smaller particles, those aerosols that are produced by coughing, those can travel 12 feet. There's even been studies showing 16 feet of spread. So we're going to talk a lot more about masks later on, but this is a really interesting study where they rigged a dummy up to produce carbon dioxide, and then they ran a laser to image a simulation of different masks and different impacts as far as somebody coughing. So in this simulation, their dummy did a cough that had 12 feet of spread, but when they added just a basic fabric mask, which is that top image, they found that the spread was limited to about 2.5 inches in front of the person's face. So it creates a great barrier for those droplets and aerosols to kind of hit against. And you can see it leaks up on the nose and does settle on the person's face, but that's at least their own exhalation and protecting others. So I want to talk a little bit about the basic structure of the coronavirus, because that's going to be really important when we talk about vaccines. It's going to be really important when we talk about transmission. So COVID-19 is actually the disease caused by the coronavirus named SARS-CoV, which is covariant 2. And coronaviruses are this family of viruses that have a spiky glycoprotein envelope, which is what makes up the outside of the virus. It keeps all of their viral RNA, which is like our DNA, but it's a single strand. It's what allows it to replicate and make more virus and infect you. So these spikes actually bind to our cells and allow the genetic material to get into our cells and cause infection. The good news is the membrane is very weak, and without it, the virus cannot infect your cells. So just basic soap can break it apart, wash it off your hands. So we're really lucky. It is an infectious virus, but it's not a particularly sturdy virus, and that gives us a way to create a vaccine and a way to control it using more common hygiene practices. Coronavirus causes disease ranging from the common cold to what we originally called SARS, severe acute respiratory syndrome. Now that is SARS covariant 1, because this new SARS covariant 2 is 79% similar to the original one that came that spread about a decade ago. This is fantastic news as far as our ability to create different vaccines and create them so quickly, because we've had more than a decade to research a very, very genetically similar virus. So that, you know, as hard as this whole pandemic has been on everyone in every aspect, in a way we are so lucky because our scientists did have kind of a blueprint to create a vaccine going into this. So the aerosol versus droplets. Basically, an aerosol is smaller than 5 microns in diameter. Just a very small particle. It can linger in the air and travel well over 6 feet. A droplet, bigger than those 5 microns, and typically falls within 6 feet. We'll talk about an interesting study where there's some special circumstances later on. But this is the primary means of COVID-19 spread. Originally, we thought things called fomites, which are inanimate objects, surfaces, were spreading the disease, so doorknobs, light switches, but those are not a main route of transmission. So it is still important that you wash your face or wash your hands and not touch your face, but it's not what's getting people sick. That's why we're not seeing people get sick from their groceries or things like that. Contact and proximity to other people is what makes people sick. This virus survives in the up to several days on surfaces, but it has a half-life of 6 hours. So that means if you were to expel 100 virus particles, within 6 hours, 50 of those virus particles would be dead. In the next 6 hours, there would be 25 more that died, and so on and so on. And you're obviously, if you have the virus, you're going to be spreading a lot more than 100 particles, but it's a really good idea to have in your head. It's not super stable on surfaces, and then it is killed by a lot of common household products, soap and water, alcohol, hydrogen peroxide, and we'll talk about that later. The droplets, the bigger things, they might have a larger viral dose because they're a bigger thing, and they also might survive longer in the environment because the saliva itself protects that outer membrane that you need to have for infection. Oh, and I apologize. We definitely want questions. There's a chat feature on the lower part of the audience box that you're in, and go ahead and whenever you have a question, type it into that chat box. I will be answering them at the end of the presentation, so don't worry if it ends up getting answered later. We'll filter through that, but I love questions. I love going into any of these topics into greater depth. So I really want to invite people to use that chat function. The question function is kind of a different setting, so just type your questions in the chat box. I apologize for not mentioning that earlier. So this slide is hard. It's a very difficult. I updated it on Monday. I had last given a similar presentation to this in September, in late September. And in the time between late September and Monday, the numbers that I had to put in for the US have tripled, and the numbers I had to put in for the world have doubled. So we have, as of the 14th, we had 301,000 deaths in our country and 16.6 million cases. Around the world, we had 1.62 million deaths and 72.8 million cases. Mortality rate, that's the number of people who, once infected, will die of the disease. It varies by country. It also varies by location within the country, because it's not a cut and dry number. It's going to depend on the age, the health of the population. It's also going to depend on whether or not the medical system is overwhelmed. You know, a potentially moderate case of COVID-19 could become a deadly case if the person does not have access to medical care. So around the world, it ranged from about 1.6 to 10.5%. In the US, and here is good news, it's about 2% of cases result in death. When I originally was giving this talk in the summer, it was about 3% of cases resulting in death. So we have better treatments, we know a bit more. The morbidity rate, which is basically, you know, how does this, having this virus, if you recover, how does it shorten your life? What are things it'll leave you with? You know, are you more likely to have a stroke? Do you develop asthma? So morbidity refers to things outside that you don't die, but you might have lifetime complications. You might die earlier than you would have without getting the disease. We don't know that rate. In the US, 1 in 1,000 people will die of COVID-19 by Christmas. In Washington State, we do have better numbers. and it's going to be approximately 1 in 2,400 Washingtonians die by Christmas. That's still just a staggering number. I kept my September 22nd numbers at the bottom because I really want to drive this home, but just remember our numbers have tripled since I put those in. So at the time in late September, we were talking 67 9/11 terrorist attacks, 80 D-days, 109 Hurricane Katrinas. There was a lot of focus on this only being a disease of the elderly, and at the time, people dying under age 55 was equivalent to 2.5 737 planes falling from the sky each week. And like I said, these numbers have tripled since September. I'm not going to go too much into detail on symptoms because I think we've all been fairly familiar. The vast majority of cases have fever or cough or shortness of breath, and around 45% of cases have all three of those symptoms. The loss of sense of smell is found in both symptomatic and asymptomatic cases. I put quotations around asymptomatic because I would consider loss of sense of smell a symptom, but it's actually very tricky. There have been statistically significant studies on Amazon reviews of the last couple of months where people put negative reviews of scented candles because they can't smell them, or they can't smell them as well, and you know, they say, oh, this candle is not as good as when I bought it a year ago, and very weak performance, and they're not aware of their own sense of smell being either lost or significantly damaged. So people who are asymptomatic or pre-symptomatic means you're infected, but you don't show symptoms, but you still will show symptoms. Those people can spread just as much infection to others, and there's no guarantee those others won't become symptomatic. They've actually found asymptomatic people drive a lot of the spread because they don't feel bad. They don't know they're sick. They're not as likely to isolate as a symptomatic person. COVID has an R0, that's how you pronounce that, value of 3, with a range of approximately 0.5 to 6. This value can vary, but it's basically how many people, if you don't intervene at all, will each one sick person get sick. So each one sick person, if they're not isolating, they're not distancing, they're not wearing their mask, they're going to get 3 other people sick. So the little diagram on the left shows that one person and the 3 people they get sick and the 3 people they get sick, and you end up with a lot of infection in a very short generation time. In industrial hygiene, we talk a lot about dose makes the poison. It's a toxicology concept. It means that anything in a high enough dose can kill you, even water. And this is true of any sort of bacteria or virus. How long you're in proximity to a sick person and how close you're standing to them determines your likelihood of getting sick. We don't know the exact infectious dose of this virus yet. The estimate is between 100 and 1,000 viral particles, but close contact is defined as 15 minutes or longer cumulatively within 6 feet within 24 hours. Before, it was 15 minutes as one chunk of time. Now it is, if you spend 15 minutes over the course of a whole day with somebody, you have been in close contact if you were within 6 feet. Asymptomatic spread, like I said, it is a real driver of infection. About 40% of infections are asymptomatic, and that number can be higher in places that people wear masks because those people wearing masks, they do suspect that they're getting a small amount of the virus, not enough to make them sick, but enough to make it so if they did get sick, their body could fight it off a little better, meaning they're not going to be symptomatic. So I have seen estimates in places that have been in masks for a long time of up to 80% asymptomatic spread. But for our country at the moment, it's about 40%. Of the symptomatic infections, about 40% are mild. Well, 15% are severe, which means they require oxygen, which means they require hospitalization. And then 15% or 5% are critical, which means they require ventilation. So if you do get it and you are symptomatic, the odds of it being quite serious are high. And just to reiterate that the asymptomatic people have the exact same amount of virus and they carry it for just as long, and that pre-symptomatic people, the people who are going to get symptoms, they're most infectious before they have any symptoms. In one of the first studies, a businessman went to Germany from China, and he attended a business meeting while feeling fine. And once he went home, he developed symptoms. And about 4 days into his trip home, he got tested and he was positive. Well, 2 people who attended the business meetings, one for just 1 day, one for 2 days, were infected from this person before he ever showed symptoms. And then they developed symptoms around the time he was getting his positive test. At the same time, 2 people who didn't go to any of the business meetings but had contact with patients 1 and 2, had contact with them, they developed symptoms not that long after patients 1 and 2 did, and then they also tested positive around the same time. So you can get a lot of spread before you have any idea that someone is sick. So the really, really exciting news this week is the Pfizer vaccine. We started administering it on the 14th in the US, and we started, we're going to have lots of different vaccine options in the future. At the moment, this is the only approved vaccine. It's up to 95% effective, 2 doses are required, and they do estimate that even 1 dose can offer protection, but it's really important to get both doses if you're doing the Pfizer vaccine, and they're set to be 21 days apart. The recommendation is that you keep all the same protocols as if you were not vaccinated until 2 weeks after that 2nd dose. And then I'm going to talk about why masks are going to be important on the next slide regardless, but there is an immune response typically with this, and we want people to be prepared for it, so they do get both shots. Headache, low-grade fever, fatigue, these are all normal responses. Some people recommend you just kind of plan to take a day off when you get it, so it's a little more pleasant and you can work around it. If you don't have any of those responses, it still means it's working. Your body just has a different immune response to vaccination. This is what's called an mRNA vaccine, a messenger RNA vaccine. They're high potency, they're low cost, you can make them really quickly. They do have very specific storage and transportation requirements. I'm sure you've all heard on the news how cold the Pfizer vaccine needs to be kept. So that is a downside of it, but the speed and how well they work is really important with these. The Moderna vaccine that should be getting approved fairly soon is also an mRNA vaccine, but it doesn't have quite as strict transportation requirements and storage requirements. So that'll be helpful once that's out. And then the AstraZeneca vaccine is a more traditional vaccine. So there's going to be different types of vaccine options. The thing about an mRNA vaccine is it does not contain the COVID-19 virus. It doesn't have any part, living or dead, of the actual virus. What it does is they train your body to recognize just a part of the virus, and then your body develops an immune response and attacks the part of the virus. And of course, given what we know, it's that spike glycoprotein membrane. So the little spikes that give it the name coronavirus, those are what this is going to break down, so then it can't infect your cells. Previous studies of mRNA vaccines include influenza, Zika, rabies, and cancer vaccines. This is the first commercially available one, but they've had a lot of really great luck with this type of vaccine for a lot of fairly tricky viruses. So Washington, we're on phase 1A of the vaccination schedule, which is high-risk healthcare workers and long-term care facilities, both the caretakers and the residents. The plan at the moment is to have 100 million US residents vaccinated by April 1st, and then anybody who wishes it by the summer, which I put as July 1st. Our population in the US is 331 million. So that means by April 1st, we're only talking about a third, less than a third of our country is vaccinated. In Washington, this week alone, we're getting 62,000 doses, and those are going to be put at 17 different sites in 13 counties. And we are hoping to get 222,000 doses by January 1st. How many people need this vaccine for us to have herd immunity? So herd immunity is the concept that enough people have either had a disease or have a vaccination to the disease that the odds of them running into a sick person, getting sick from that person, and transmitting it to another person are low. So the World Health Organization estimates that 65 to 70% of the population need the vaccine to have herd immunity. And it really does look like it's going to be the vaccine, not just getting sick, because it seems like there's a possibility that if you get sick naturally, you're not going to retain long-term immunity. There's a lot of different studies, but it is looking like you will need the vaccine for that long-term immunity. We still don't know how long the vaccines will be effective for, but they've been pretty hopeful about it. Due to the lower rate of mutation of this virus compared to things like influenza. So the graphic below kind of explains herd immunity. In a population where a very low number of people get the vaccine, and the vaccinated people are represented by the blue dots, healthy people are the white dots, and sick people are the red dots. Anywhere where a red dot comes in contact with a white dot, you have a risk of infection. In a high immunization rate, the red dots come into contact with more blue dots who are safe from it, and those blue dots protect the healthy people who are not vaccinated. So that's why we do have to distance, we do have to wear masks until we hit that level of herd immunity. That's going to be at least the summer. It's going to depend on the vaccination rates of people. Like I said, if there are people who are nervous about the mRNA vaccines, there's going to be more traditional vaccines, probably approved around March. So we're going to have a lot of options, and there's going to be something that works for you, and you can work with your healthcare provider to figure out what the best choice is. Very briefly, I want to talk about WANotify. It's a really important app or setting on your smartphone. Basically, you download it for free, you turn it on, and you're set to go there. If you were to get sick, you would get a code from your healthcare provider, and you would plug it into your app. And the app bounces completely anonymous strings of code around to other cell phones in the area. And what it would do is it would send an anonymous bit of code to every cell phone it bumped off of in the period where you were infectious, and if you were in close proximity to that individual, and it would anonymously tell you, oh, you've been exposed. We've done a great job in Washington downloading this app, but I would really encourage anyone who hasn't to take the time and do it. I just checked mine while we're on this call. It says no recent exposures. That's great, but it only works if people use it. And we're going to talk about a study in just a bit that shows how important these tracking, these contact tracing applications are for figuring out what happened, figuring out exposure, figuring out risk in situations. So it is completely anonymous. It's very safe technology. They've been using it in other countries and other states for a long time during this pandemic, and it really will help. So when we're talking anything in the workplace, we look at what's called a hierarchy of controls. You can definitely apply that to a virus as well. So for COVID-19, the most important thing you can do is eliminate the risk of your employees contracting the virus. The easiest way for some workplaces to do that is have everyone work from home. Working from home does have complications. You want to make sure your people have an ergonomic setup, that you want to make sure they have what they need to do their work well. But as far as safety from the virus, the best thing you can do is eliminate the need for them to come into contact. That, of course, is not going to work for every workplace. So the next most effective thing you can do are engineering controls, things that physically separate the people and the pathogen. So that would be installation of barriers, that would be physically moving desks around, installing, instead of using cubicles, installing floor to ceiling traditional workspaces. And we'll talk about that more with ventilation. I consider a mask to be an engineering control because they're a source filter. They're filtering out what you say, what you do. Administrative controls are things like teaching people what the right things are. So those are your posters, that's your safety plan. That is teaching people how to stay safe. That's things like this webinar. And then PPE is rated the least effective. And I want to really stress that's not because masks don't work, it's that people have to choose to wear their masks and wear them correctly. So anytime PPE is on something, it's always ranked as least effective because it relies on the individual doing everything correctly. You can't just put in a concrete change like a barrier and have that concrete amount of protection. So I consider masks to be an engineering control because they act as a filter, but they also do rely on people being trained to wear them and wear them correctly. There have been years and years and years of study based around pandemic influenza on homemade masks. So we actually have known for a long time that homemade masks do offer you protection and they offer people around you protection. It makes sense. You know, it's not as easy to breathe through a mask as it is just breathing on your own. That means it is providing a barrier. And I'm going to talk more about how the science of it works on the next slide. But this is just a basic study on some different options that people made, and they tested very small particles, actually smaller than the viruses on average, to show you what they were filtered out. But the most effective mask is the one you wear. Your workplace may have specific requirements like no bandanas because they're very low protective rate, but whatever you're gonna wear is better than nothing. No face covering offers no protection. A double or triple layer cotton mask of at least 180 thread count, that can filter up to 70% of particles if you are wearing it over your nose and it fits correctly to your face. So the most effective mask is the one you're going to wear. Employers in Washington are obligated to provide masks for in-person work and the appropriate masks for in-person work. We're going to talk a bit in PPE about what that means and when situations might warrant having more than just a fabric mask. And of course, Washington State, they are required in all indoor environments outside of your own household, and any outdoor environments where you cannot social distance. So the basic things about how a mask work is both those large droplets and those smaller aerosols are going to hit the mask. Of course, an N95 is going to be much more effective of both filtering them out of what you're breathing in and out of the air around you. But even a surgical mask or a cloth mask can be quite effective. People a lot of times say, well, those aerosols, they're so small, they're smaller than the holes in the fabric, wouldn't they all just more or less leak out? And that concept I always compare to shooting a BB gun through a soccer net. That is not how particles that small actually move in reality. You are not shooting a BB gun through a soccer net. You are throwing feathers at the soccer net. Yeah, some will probably get through. The majority are gonna float, they're gonna go sideways. So these smaller particles, for the most part, are gonna just end up stuck to the fabric rather than going straight on through. On the left-hand side, there's a little study from Europe, and they use tea cloth, which is a very, very loose woven fabric, fairly similar to a bandana. they used a surgical mask, and they used the equivalent to an N95. And for just sake of this illustration, they put in 100 particles. And so as far as inward protection from the environment, the T-cloth, that very loose weave, gave almost 70% protection in the environment. The surgical mask gave 75% protection. And then, of course, the N95 equivalent gave almost 99% of protection from other people's. As far as protecting others, that loose cloth, not surprisingly, didn't do too much to help others. It leaked about 90% of the particles into the environment. But from that very first slide, we talked about how the fabric mask reduced how far the carbon monoxide went from the dummy's face to just 2.5 inches. So even if you have 90% of the same particles coming out because you have a very loosely woven bandana around your face, they're going to be traveling a lot less distance. So masks are utterly essential for this pandemic. So things to think about for indoor work. Again, strongly recommended to work from home until phase 4 if you possibly can. If you can't, you need to follow the specific guidelines from the Department of Health and Labor and Industries for your workplace. And I do have links in this presentation to them on the slide we're coming up to. Wherever possible, have people work alone in a contained space with separate ventilation. So what that means is don't put one person in office A and one person in office B, and it turns out all the air from office A is going directly into office B. In that case, office B should just become a storage space. Wearing masks, very important if you're in a cubicle system, if you're not in a contained system, if the air could possibly be recirculating. So LNI does have guidelines on when you can be without a mask, but I'm linking to them. In general, masks are your best friend. You need to be completely alone and separate ventilation really to be safe with that. You want ventilation that's getting filtered, things like that. Even with the mask, you need to keep that 6 feet of distance, and you need to not linger in a space for a long time. You know, if you have people working, they must work in office, they must be in cubicles, you might want to consider a 10-foot spacing, or you might want to consider raising those cubicles to the top of the ceiling. I've seen shower curtains working really well as a cheap barricade. It's not as attractive, but you know, safety is the most important thing. So after those masking and social distancing, isolating, ventilation is going to be the most important consideration. And we're going to go into that and have kind of user-friendly ventilation. But opening windows, opening doors, those are really easy ways to increase the ventilation in a system. So for in-person work, you need to have a phase-specific COVID work plan. So that would mean right now we're in phase 2, and there's additional aspects of the governor's mandate. So your written program needs to have all of those aspects. It needs to say how you're going to train your people, what signs are you going to use, and how are you going to keep educating them throughout the pandemic as we learn more things. And it needs to be in a language your people understand. Who's going to supervise all of this? You know, make sure you're following that. How are you going to have your workers check their health? Are they doing it at home? Are you checking before they can enter the space? What are you doing to make sure people aren't symptomatic and going to work? What are your hygiene practices? How are you going to clean? How often are you going to clean? What are you going to use to clean with? What personal protective equipment do you need? We're going to talk a bit about if you're working within 6 feet of somebody, just a fabric mask is not going to be enough. So there's aspects to the personal protective equipment that are going to need to be in your plan. How are you going to distance people? Are you going to move their desks? Are you going to put in those shower curtain barriers? What are you going to do for your ventilation? Are you going to increase your filter rating? Are you going to increase the amount of outdoor air you're pumping into the building? What are you going to do if your people get sick? And one of the things that I think is important to note is if someone does get sick, you should not be telling everybody the name of the person who got sick. That does violate ADA standards. So you want to have a reporting procedure where the sick person talks to the appropriate person in your company, and then that person will figure out who they were in close contact with. They'll encourage them to help the state with contact tracing, and kind of figure out what your plan is going to be. What do you do if you have a lot of close contacts, things like that. There's going to be unique requirements for each industry. Like I said, reach out to me because this does have to be a general presentation. And then below I have some links for the Safe Start reopening plan, and you can go through, and there are a lot of businesses with their different plans and requirements there. There are some businesses not listed, and you kind of have to maybe meld a couple industries to make yours, but there's a lot of resources there, and we're always happy to help. So virus transmission is notedly higher inside. They found in the beginning of this up to an 18 times risk of indoor activities versus outdoor activities as far as your risk of getting sick. This study just came out last week, and it's really interesting, out of South Korea. One person was infected after just 5 minutes in a restaurant, and the person was 20 feet away from the original sick person. So this is a diagram from the study. They were able to recreate the situation months after it happened by using that cell phone data from a similar program to WANotify. So basically the sick individual is B, and she was having a business lunch with D, who later became infected from sitting across from her. And that's fairly understandable. You're close, you're not wearing a mask. But this particular restaurant, it had no windows, and it had an AC blowing at a fairly fast rate, similar to a fan. And one of the outputs hit more or less directly where person B was sitting. And she was sitting with her back to the wall, and the air hit person B and bounced off of the wall, creating kind of a wind blade. It was able to take those bigger droplets, the ones that usually fall within 6 feet, and infect 2 other people in a straight line. The furthest one was person A, who was only in the same place as person B for 5 minutes. So masks should be worn indoors. You need to maintain that distance, and you don't really want to linger in indoor spaces. I have been recommending people support their local restaurants by ordering out. If you do need to eat there, obviously outside's the only thing that's allowed at the moment, but I have encouraged people through all of this, do not eat indoors. There's just too many variables. You can't base it on occupancy. You have to base it on a lot of pretty complicated factors. So basic ventilation. Anybody can do this. It doesn't need to be stressful. You can definitely hire an HVAC expert. You can definitely hire an industrial hygienist, but add in outdoor air. Open the windows, add a fan. Be sure you're not angling a fan where it's hitting a person and then going to other people, because you'd be creating the same situation as the South Korea study. You want to have the cleanest air around where people are and the dirtiest air going out. And that's called clean to less clean air flow. So that's what I was talking about. If you have office A and office B, and office B gets the ventilation from office A, office B needs to be a storage space right now. Increase the amount of outdoor air you can use to the highest amount your HVAC system will allow. Try for at least 6 air exchanges per hour. An air exchange is more or less, think of the air in a room. 1 air exchange is the amount of time it takes for all the air in that room to be new air. They recommend prior to and after work flushing the space for 2 hours using outdoor air. Honestly, that after the workday is more important than before, but go for both. Do as much outdoor air as you possibly can. If you can do 100% outdoor air, that is fantastic. McKinsey & Company has some resources, and we're also going to talk about ASHRAE resources, but as far as all this goes, for the layperson, the easiest thing to be is filtering the air. You don't want to recirculate air without filtering it. You want to avoid recirculation wherever possible, but changing filters is the simplest form of ventilation improvement that you can do. If you have poor airflow, don't have a lot of windows, things like that, you can use portable HEPA air filters next to somebody, you know, someone who has to be in the office 8 hours a day. You can use that as a way to control the source of everything, but that does mean you need to maintain the equipment, you need to change the filter, things like that. So it is an additional step, but it can be really useful if you don't have the best airflow in your facility. Very basic HVAC information. A lot of systems use a minimum efficiency rating value, MERV, of 8. The recommendation is move that up to MERV 13, which you may be familiar with this summer if you made a box fan air filter for the smoke. The MERV 13 is the minimum rating you wanted to make your homemade filtration system. So it's going to get 50 to 85% of very, very small particles out of the air. Of course, you do have to make sure your system can handle that increase, but most can handle an increase to MERV 13. Again, minimum of 6 air exchanges per hour. 6 to 12 is a great range to go for. Then ASHRAE, they have all sorts of both technical and non-technical references on this resource page I put in here. And so it doesn't need to be intimidating. There's a lot you can do for free or very little money that can improve the airflow in your building. PPE hygiene and sanitation. If you are having people work within 6 feet, you need more than just a fabric mask. You might need an N95 if you can get one. You can add a face shield to a mask. You could get a half-face respirator, or you can throw up a barrier in between the people. You just need more protection than just a fabric mask for work within 6 feet. If you are using an N95 or other respirators like a half face, you need to have a respiratory protection plan. You need to train your people on how to wear and how to take care of their respirator. They need to be fit tested and they need to be medically cleared for use. If this is a voluntary thing, as in it's not necessary for the work you're doing, you still need to be medically cleared to use them because they do put a greater burden on your lungs and your health. So you do need to make sure your workers are safe to wear them, even if they're doing it voluntarily. If they're doing it voluntarily, you can skip the fit testing portion. People should be washing hands regularly, even though they don't think surfaces really are driving the spread. It's important for COVID, but it's also really important for other common diseases like influenza. Make sure you change your mask frequently. This will help the skin on your face. It'll make your mask more effective because it's not getting wet. I like to only wear a fabric mask for about 2 hours before I switch to another one. Gloves don't need to be used for every single task because it isn't driven by surface spread. If you have a fairly regular job where you're not handling a lot of things other people are handling, you can just wash your hands. But if you're going to be doing a lot of touching things other people have been touching, gloves could help keep you from damaging your hands from washing them so much. When you're cleaning a surface, and one of the rules for Washington State is that you clean shared surfaces and shared tools as often as necessary, you want to use the least harmful approved products for COVID-19. The EPA lists every single product that you can use for COVID-19. But like I said, it's not a super sturdy virus. So you really, if you can, want to avoid bleach. And there's some bacteria that you need to use bleach to kill them. But if your only worry is COVID-19, bleach, it can really cause a lot of asthma. It can cause a lot of issues with skin. It's a fairly dangerous product. I personally like alcohol or hydrogen peroxide-based products, and always unscented. You want to make sure you're taking care of your people's health, especially since the surface transmission is not as much of a worry as accidental poisoning from cleaning products. So I just put a reminder. We had a lot of incidents of people making poisonous gas, this toxic gas this spring, mixing cleaning products. You always want to review the safety data sheet for any cleaning product you're using. You want to make sure you use it exactly as intended. You want to check all the ventilation requirements. You want to do everything exactly as it was intended. So this is just a fun chart of all the different ways you can make highly toxic gases by combining common household cleaning products. So things I've been seeing out in the field, I've been doing surface sampling since March, and we had positive samples on high-touch surfaces. Not a ton. Usually we would know we were going into a situation where there had been a positive individual, and we were just more or less tracking things that they might have touched. July through October, positive samples were very rare. We had a statewide mask mandate at that point, and we also had a low % of people infected. Now we're seeing a lot more positive samples on doors, light switches, bathroom stalls, things like that. There is a higher % of people infected. It also could be related to people touching their mask and then touching surfaces. In the summer, that's not such a big deal, but in the winter, if you're outside and it's cold, you might have a runny nose. So touching your mask when it's dry is much less likely to get virus on your hands than when you touch your mask and it's wet from your breath or your nose. Air sampling. We do sampling to measure the efficiency of air systems as part of indoor air quality. A study of hospitals found COVID-19 aerosols, those small particles, in 2/3 of the rooms studied, despite the fact that they had 12 air changes per hour, and despite the fact that they were in the general ward, not the COVID ward. So it was traveling. There's a new product that I have not used yet, but I think is really fascinating, called Safe Traces. And this is just a safe biological that's the same size as COVID-19. It's harmless, but you can basically spray it in the air. It's going to mimic that COVID-19. It's going to show you how efficient your system is. You do the same PCR test. So it would show you how the virus would move in your building. Without needing to actually have someone who's sick with the virus to show that. Other things to think about as you move into reopening. Buildings aren't designed to sit empty or have a really reduced number of people. So there's a lot of things that can develop that harm human health that aren't COVID. You can get lead and copper buildup in water systems depending on the area. That can be as short of a time as a few hours, weeks, months, but even just reduced occupancy, you can see a greater number of that buildup in certain locations. Mold and moisture, you can see that within a few days of a leak or a system failure, or things that we see pretty often in Washington State with our damp weather. Just lack of air circulation or turning the building on kind of a holding mode. Legionella is a pathogen that's found a lot of times in like warm water pipes. It causes a respiratory illness, and it can build up if systems aren't used over a few months. A famous case of Legionella was traced to a home supply store from a hot tub. Basically, they had a hot tub that was both warm and turned on, but it didn't have any sort of chlorinated additions to it because it wasn't for use, it was for display, and people who were near it ended up getting infected with Legionella, Legionnaire's disease, based on the presence in the air from the bubbling hot tub that didn't have any disinfectants in the water. You can have general indoor air quality concerns. They can be a little more related to off-gassing of products, solvents, things like that. Or they can be as simple as your air smells really bad because your heating has been off for months. But if you want more information on that, the CDC has a great resource page. And of course, I'm always willing to help. So this is my contact information. Email is always the best way to get a hold of me, and we can arrange a phone call. So now we have time to go to questions if there's any in the chat. So just give me a second to expand it out. Oh, well, does anybody have any questions? I'm happy to talk more about the vaccine, about the rollout, about basic things you can do to protect your people.
Hi, Shonnessy. This is Sarah. I see 2 questions submitted in the question feature. So I'll read them out to you, and let's just start with the first one. Where can we review the vaccine studies for Pfizer and others that may be approved soon?
Well, I know the CDC has some. You can usually go to the manufacturer website. A lot of scientific journals have the reviews. I know Pfizer released theirs. I believe Moderna released theirs. I don't think AstraZeneca has released theirs yet, just on the phase they're in. So I would say source material, you're going to the FDA, the CDC, and the company itself.
Perfect. Thank you. And then we have 2 more. The next one is, how would an employer go about finding out how many air exchanges they are getting in their offices?
So the easiest thing, assuming your system is up to date, is there's tabulated data that's going to show you what it should be doing if it's working correctly. There's also instruments you can use to measure the airflow in a space. And then, can employees wear just face shields, or do they need masks too? Face shields are a great additional barrier, but they do almost nothing to filter, which is so important. So face shields, maybe about 2% effective on both protection and the protecting others aspects, but they're a great addition to your mask that you're wearing already. And you can definitely add a face shield to a mask if you're working within 6 feet of another person. Given the study cited, should we be wearing masks at all times when inside our offices, even when no one is in close proximity? In general, yes. If you don't know that your air, like what's going on with your air, if it's possibly being recirculated and not filtered, yes, you need a mask. If you're in a cubicle and you're in the same space as others, yes, you need a mask. Let's see. My business used to have a lot of airplane travel, but we have canceled all flights over the last year due to the pandemic. I've recently seen airlines advertising that their filters are actually so good you are safer on their plane than other places. How much of this is fact and how much is marketing nonsense? Basically, I'm wondering if you would consider it safe enough to start flying again if mask wearing is done properly by our team, or should we continue to avoid air travel through the next year? It's going to depend on the airline. In general, those HEPA filters on air systems are really good. It's better quality air, better quality filtration than you're going to get many other places besides hospital setups. So in general, what they're saying about the filtration is really true, but the spacing, I've seen the concept of adding in kind of like a physical plastic barrier between seats. I love that combined with mask wearing. It would have to be combined with mask wearing. But because masks do reduce the direction of travel by so much, I do think there will be safe ways to fly. My concern would be when you're waiting for your flight. My concern would be, does the airline space people out? Do they leave rows empty? Are they committed to all of those aspects? There have been a few documented cases where they've found some plane spread, but in general, I think there's ways you could make it safe. I would still avoid it if possible, until the summer because of the vaccine schedule and the general population. Also, you tend to see a lower spread when people can be outside comfortably. But there's a lot of truth to the ads that the airlines are having. So the main thing is, how far away can you be from people? Is there an additional physical barrier? But yes, their HEPA aerosol systems are quite good. What protective measures do our field staff use when working together within 6 feet? We have face shields, but since we do a lot of hazardous materials work, we can have both people in a half-face respirator. The thing with both N95s and half-face respirators that have valves is they only work if everybody is wearing them, because your exhalation is not filtered to the same extent. Well, with the half face, it's going to be. With the N95s, with the exhalation valves, it's not going to be filtered to the same extent. So we try and match people up, you know, both in N95s. We have a small stock of N95s without valves, so those are helpful when we work within 6 feet. But it just depends on the type of work, how long they're going to be lingering. If you're working a full day next to someone in 6 feet, I would rather see you in a respirator than a fabric mask and a face shield. I'm checking to see if there were other questions. Really appreciate all the input from everybody and the opportunity to give this. I'm really excited to do my more in-depth presentations in January, February, March, and I hope to see some of you there as well. I think if we don't get any other questions in the next couple minutes, I'm going to draw this to a close, but I really, really appreciate everyone's time today. All right, well, thank you so much. Please feel free to reach out. Like I said, email is always the best way to set up a time to talk to me, and reach out over anything. Thank you.